Good afternoon, everyone. Thanks for having me today. And today we are going to talk about holistic approach to cancer, but based on the theme of Sadhguru's Center for Conscious Planet, I'm going to focus more on yoga and mind-body practices in the care of cancer patients, but I'm also going to touch on other areas of holistic approach. So I will share my slides. Give me a minute. And when I'm working on my slides, it's time to kind of orient to this talk. Maybe adjust your body, screen your body for some tension, and see if your posture is good, because most of us working in virtual settings, these are some things which are very important for physical well-being. So the topic I'm going to discuss, as I mentioned, is holistic approach to cancer. And I have no conflict of interest to disclose, but however, I do want to share that I meditate and I attended programs conducted by Sadhguru and benefited the practices personally, and therefore I use the practices in the meditation practices in my meditation trials, and also recommend some of the practices to my patients, as well as I recommend other meditation practices as well to my patients. So the slides and my presentation will focus on the scientific evidence and our approach to cancer patients. So first, our learning objectives of today's discussion is to discuss what is integrative medicine. So what is that I do? And what is the difference between alternative, complementary versus integrative medicine? So for those of you with some exposure to oncology or taking care of cancer patients, I think you might have heard these terms used commonly by patients. And when you're doing conducting a research trial, many patients may use these terms. So that is going to be our first objective, to kind of understand the differences. So the second objective is to review the current evidence of mind-body practices in integrative oncology. And the third objective is I will be discussing different integrative medicine approaches such as nutrition, exercise, incorporating acupuncture, oncology massage, and touch a little bit on herbs and supplements that patients frequently want to talk about. So the definition of integrative oncology is it's a patient-centered medicine as everything else is, and it's evidence-informed. So we very carefully, the definition is evidence-informed and not evidence-based, because some of the things that is prescribed may not have multiple randomized controlled trials, but there is safety data and it is informed by science that it's known to work. And we utilize mind and body practices routinely. We use natural products, lifestyle modifications, alongside the conventional cancer treatments. So in terms of the differences between the alternative medicine, complementary medicine, and complementary integrative medicine and integrative medicines, that alternative medicine is used in the place of conventional medicine. For example, if a patient is diagnosed with cancer, like let's say breast cancer, and the patient is asked to do surgery followed by radiation and probably chemo, the patient decides not to undergo the conventional treatment and go towards probably juicing carrots and doing some herbal treatments and just doing IV vitamin C and not foregoing or not doing any of the conventional treatments. So that is alternative medicine. Whereas complementary medicine, you do non-conventional approaches with conventional medicine, and complementary and integrative medicine, which we practice, is the use of non-mainstream approaches where physicians prescribe some of the non-mainstream approaches along with conventional medical approaches for cancer. So if you look at the CAM use among cancer patients, it's very, very common. And you can see that overall, when patients were asked why they used CAM or complementary alternative medicine, that's the term which it was called before. Now we use the term CIM, which is complementary and integrative medicine. But this research was done in 2000 at MD Anderson, so it still has the CAM the word can. So if you look at the goals, when patients were asked why they use it for various reasons. One, to reduce the side effects of conventional treatments like organ toxicity, which happens with chemo sometimes, to improve quality of life, for immune system, or prevent further cancers. So there are so many reasons. And one of the things which is interesting is that it's very frequently used, but not all patients share that with their physician. For example, if you look at the numbers here, it's the 88% of our patients use CAN, but only 62% share with their physicians. Whereas vitamins and herbs, 77% use it, but only 64% share with the physician. Mind-body approaches. It is very interesting that almost 80% of cancer patients are using mind-body approaches, but probably they're not sharing it enough with physicians. So this tells us that people are moving towards some kind of mind-body practices, especially this is more common, seems to be in cancer patients. And therefore, integrative oncology is a rapidly developing field, and many of the cancer centers are actually having integrative oncology practices within their structure of cancer care. So NCCIH is National Center of Complementary and Integrative Health. They have classified the CAN or CIM into 3 categories. One is natural products, such as the use of vitamins, minerals, herbs, and things like that. Mind-body practices, such as meditation, yoga, acupuncture, hypnosis, Pilates, Tai Chi, Qigong, massage. Other complementary health approaches such as Ayurveda, homeopathy, naturopathy, traditional Chinese medicine, and functional medicine. So this is kind of the model that we use in our practice for holistic approach to cancer patients. So the model involves emphasis on 3 important aspects. So first is physical aspects, which is nutrition and exercise. Especially, but we will also be talking about acupuncture, massage, referrals to other teams. And every single patient, we talk about their mind-body health. So we incorporate psychology consultations, if necessary, meditation, music, Tai Chi. So we deliberately use these practices in caring for our patients. And the third is social aspects, which is social support and social work, and group programs such as group classes, meditation classes, and yoga classes. So with this in mind, every patient is evaluated in terms of physical health, mental health, and given a care plan which is comprehensive or holistic in nature. So this slide is to just give an idea of what kind of patients we see and who is interested in integrative oncology consultations. So when we looked at 6 months time period in 2019 and 2020, and also previous studies in 2017, 2016, it is very consistent that most of the patients who seek integrative oncology consults tend to be women. And they are in middle-age group, around 50, and the median was like 58, 56. So it's almost middle-aged people, mostly women, and the most frequent cancer diagnosis is breast cancer. Of course, more research is needed to clarify if it's because the diagnosis is breast cancer that there's more women or more in general interested in seeking more of integrative or holistic approaches. So switching gears, let's discuss about stress and the impact of stress on cancer and how mind-body practices can help with stress management and indirectly cancer. So I think this is something that a lot of people are telling me, both patients and also colleagues, especially during the pandemic. Most people feel like they need to change the job because everybody has gone through a very stressful situation recently. And most of the people are working from home, so they feel like they need a smaller house, probably bigger house for somebody. And they spend more time with family, depending upon what kind of professional they are, especially in the pandemic. You feel like you need a different family. So, of course, these are not possible to change. So it is what it is. And maybe if they change all these 3 things, there will be new sources of stresses. And why it is important to talk about stress, because often I see that patients, when we talk to them, they're very, very stressed, especially with cancer diagnosis. They're dealing with physical ailments, financial distress, work burdens. They're given 6 months or 3 months as by their oncologist for prognosis, and that is very distressful about the future. So the mortality is very close to them. So they are very, very going through a very stressful situation in their life. So is it important to address the stress itself? I would say absolutely yes. Not only for the quality of life, but even for mortality. So more and more studies are showing that depression is a predictor of mortality in cancer patients and even disease progression. And even more studies, cortisol rhythmicity is something that we see that it's connected with depressive symptoms, which makes sense because cortisol is a stress hormone, and depressive symptoms and shortening of telomere length. So many studies after studies are showing the relationship between the stress and mortality and morbidity. So why is the case? So when you look at the tumor microenvironment, it is very closely regulated, and it is regulated or has impacted by the stress hormones. So when someone is stressed, of course, we release or we activate the sympathetic nervous system and the adrenal gland. And adrenal gland is going to release the stress hormones, the adrenaline and noradrenaline. And as you can see, the noradrenaline has a direct impact on the tumor microenvironment, as well as indirect impact on the tumor. So both directly and indirectly, stress is connected with the cancer cells. So looking at the individual cancer cells, we can clearly see that when there is noradrenaline and adrenaline, which is stress hormones, it is impacting multiple pathways. It's impacting the oncogene activation, which is going to promote the cancer cell growth. It is going to inhibit apoptosis, which is cancer cell death. If inhibited, it's going to affect the DNA repair genes. It's also affecting the immune system. It's affecting the inflammatory signaling. So it's affecting at various immune cells, even metastatic response is affected. So there are so many things which happens within our body because of the stress and the stress hormones. So what do we do about it? So the role of mind-body practices is not to eliminate the stress completely. So often when we are talking to patients, if we say that stress is affecting you, and we need to do something about it, people are going to say, of course I'm going to have stress. So it is important to present the information carefully to the patients, especially when we are discussing about mind-body practices, because our goal is not to eliminate the stress, but to give patients tools to help manage the stress. So some of the tools are, one of the major tools is a mind-body practice, and the mind-body practices can be multiple things like meditation, yoga, Tai Chi, Qigong, or music therapy. So basically the goal of the mind-body practices is to increase the self-awareness. Often when patients are going about day-to-day life, and also it applies for us when we're going over day-to-day life, there are so many things we think about, and our mind might constantly wander between different aspects of our personal and professional life. And the mind-body practice helps enhance our self-awareness, because when we do the practice, we are connecting the body and mind by using sound, such as in meditation or music, using breath, such as in yoga or pranayama, movement like yoga or dance or Tai Chi, and other approaches. So there is evidence that mind-body practices improves multiple aspects such as quality of life, sleep, pain, nausea, anxiety for cancer patients. So these are some of the studies which shows benefits in multiple areas. So some of them were done at MD Anderson, meditation for cognitive dysfunction, for yoga for patients, breast cancer patients undergoing radiation, Qigong studies for breast cancer, renal cell cancer, and yoga program for lung cancer patients, and also their caregivers, because spouses and the family members of cancer patients are also going through severe distress. So it's important to take care of the caregivers also. Lung cancer, high-grade glioma. So, so most of these studies are done in outpatients. So when we looked at hospitalized cancer patients, I was a hospitalist when I started my career, and I was taking care of cancer patients. And one of the things I always felt that we have to do something about is the amount of distress that these hospitalized cancer patients have when they're, especially when they're hospitalized. So we were discussing about that with Dr. Subramaniam, and Dr. Subramaniam helped me and guided me in establishing this trial at MD Anderson. So we did Isha Kriya for hospitalized cancer patients, and we randomized the patients to Isha Kriya arm versus slow breathing arm, and we found that people felt more peaceful and relaxed overall after meditation in the study. But we did lose a lot of patients to follow up after they were discharged, because it was not a funded study and we didn't have lots of support to call and follow up on patients or write to them or email them or things like that. But we have some preliminary data which is showing that it was helpful to cancer patients. So in regards to yoga, yoga is a movement-based mind-body practice with multiple benefits. So you could see that during cancer treatment, yoga helps in many aspects, such as fatigue, quality of life, stress, anxiety, depression, sleep, even pro-inflammatory cytokines and cortisol. Yoga studies have shown that there is decrease in the cytokines, decrease in the cortisol, and in post-treatment, there is benefit in sleep, in addition to the benefits that we see pre-treatment. And in terms of the symptom management, joint pains is very common in patients with breast cancer treated with aromatase inhibitors, such as tamoxifen. And these patients will benefit immensely from exercise, acupuncture, and also yoga, which combined in treating them. So music is another area which is a mind-body practice which can be used, and many of the music studies seems to be in the perioperative setting, post-op setting, but we do use music routinely for our patients. We have a music class, and we do music therapy for palliative care patients, for ICU patients, one-on-one therapy for certain patients to express their emotions, and that can serve as a mind-body practice. We have a group class which involves Tai Chi and Qigong. We choose patients which class to go. Tai Chi is a practice that you might have seen, and people do it in the movies and in the park. It's a slow practice which involves hand coordination. And Qigong is a milder form of Tai Chi, which can be done even by patients who are very debilitated, and they can do it from their wheelchair. So we do these classes before the pandemic in person. And after the pandemic, it's offered via Zoom, and we measure their distress before and after. Even one class has shown to improve their distress significantly, the global distress, physical distress, psychological distress, fatigue. Patients perceive that they improve in all these areas. So hypnosis is another mind-body practice which is not often utilized, but patients are looking for it, and slowly we are moving towards it. Can be utilized in an OR setting. But of course, at MD Anderson right now, we're still in the research stage. We have not moved to implementing it in clinical practice. So many societies which are looking at mind-body practices and holistic approach in cancer care, and this was not the case a few years ago. But now ASCO, American Society of Clinical Oncology, Society of Integrative Oncology. So these are ASCO endorsing SIO guidelines, saying that yes, music, meditation, stress, yoga, we have sufficient evidence to say that these are helpful for anxiety or stress reduction. We have evidence saying that yoga can help with mood disorders, meditation and yoga for quality of life. So there is a rich body of evidence now compared to a few years ago. And ASCO, not only ASCO and SIO, NCCN guidelines, which is considered gold standard in cancer, has also included these practices such as art therapies, music, spiritual support, and also other mind-body methods in terms of pain guidelines. So this is recent pain guidelines, 2019, where there's a big support for hypnosis, imagery, mindfulness-based stress reduction. And when I say imagery, this is something that is that people like, and it's something that we have in our website. So we have samples of visual imagery where people are imagining being in a different place and what's happening to them. And we often recommend that for patients on radiation. So we ask them to go to our website and use examples and create their own imagery. And I think Sadhguru also has one of the meditation called Bahulashiti meditation. I have not seen studies on that particular meditation in the clinical setting, but it would be something similar that we have in our website, which is kind of helping the patients to imagine or use imagery for management of their stress during radiation and during other stressful procedures such as MRI. And that's an interesting area which requires future studies. So how do we approach the patients, and how do we come up with a holistic care plan? And how we incorporate the mind-body techniques we learn in the clinical care. So first, when we meet a patient, every single patient is given this handout, whether it is in person or we do a virtual visit. We ask them to rate their anxiety, depression, sleep, and other symptoms on a scale of 0 to 10. We also ask questions on their quality of life, physical health, mental health, and this is called PROMIS-10 scores. So every patient who walks into our practice, we collect these data. This helps us understand what the patient is going through and where we need to focus on. Is it our physical well-being or emotional well-being, or which area needs emphasis? And at the end of the conversation, the end of discussion, or throughout our discussion, we use this circles as a guideline to come up with a plan in the diet area, exercise area, a plan for the mind-body practice, a plan for sleep, integrative approaches for their symptoms, example, acupuncture for hot flashes, joint pains, oncology massage, psychology consultation, and we also counsel people on supplements. And the areas that is addressed heavily depends upon what the patient is going through, why they're referred to us, and what the patient wants to talk with us about. So in terms of diet, the diet that we promote is plant-based diet. That is because of the rich body of evidence in cancer that healthy diet or plant-based diet based on recommendations from American Institute of Cancer Research is ideal. And it is not just for cancer patients, it's for every one of us and for prevention of cancer as well. So at least 50% of the plate has to be filled with vegetables, and fruits get a small section. The reason is fruits are rich in sugar, and we do know that high sugar intake is not ideal for metabolic pathways, especially it triggers certain pathways which are not ideal for cancer. And for many other reasons, high sugar fruits and making a tall jar of fruit smoothie, which some of our patients do, is not always a good idea. So incorporating an ideal balance with more vegetables, moderate fruits, whole grains, beans and lentils and nuts, and very small amount of animal-based protein if the patient is interested in doing it. And almost we suggest eliminating red meat, or if they have to do it as minimum as possible, not more than 2 times a week. So basically, the American Institute of Cancer Research-based diet is to change the way the patients eat and incorporate more plant-based eating in their daily life. So again, this is evidence showing that very clearly the vegetarian diet versus vegan diet versus non-vegetarian diet and the incidence of cancer, and there's a clear relationship that the vegan and vegetarian diets are definitely better than eating a meat-based diet. So exercise guidelines is something that every patient gets a customized input based on their medical condition. But overall, if they're healthy and if they're able to go with normal life, 150 minutes of exercise is recommended per week per American College of Sports Medicine guidelines, and strength training 2 to 3 times per week, and flexibility exercises. Often patients are deconditioned, and for those patients, we incorporate yoga therapy. So the yoga therapy that we use, we give them the videos, and we also have videos, which is public information in our website. And we also have group classes. So every week there is a group class, either a yoga class or a Tai Chi class. So we invite patients to participate in the yoga session so that they can benefit from it and use it as a part of their exercises. And if someone is not interested in doing yoga, then we would ask them to do other exercises such as Tai Chi or Qigong, which is also similar to yoga and can be gentle. So acupuncture, we use acupuncture, especially I have the slide next to exercise because a lot of our patients will complain they are not able to do yoga because of joint pain. And if there is no specific reasons for joint pain, or after investigating the reasons for it and creating appropriate referrals, we use acupuncture for symptom management. So acupuncture can help with joint pain, neuropathy, fatigue, so people can get back to yoga, get back to exercise, and derive the benefits of both acupuncture directly and indirectly get the benefits of yoga and exercise. So it can be frequently utilized not just for cancer patients, but also for other people in your practice. And oncology massage can be used for muscle pain and fatigue, and that's often utilized for neuropathy as well, which is a side effect of cancer therapy. So most people would like to know more about supplements, and this is something that integrative oncology also touches on, especially people, the population that we see. Some of them do not know what is integrative oncology. Some of them are aware, but they're not fully aware. Some of them are taking herbs and supplements. Some of them are highly educated and they have read a lot and they have tried alternative therapies and they want to take things like turmeric and green tea extracts. So this is an area that is addressed, and open conversation is very important in this area, because if they are told just to stop, of course, it decreases the trust between the physician and the patient, and patients, research has shown that patients are going to just continue taking it. So a very close communication and discussion about the adverse effects of herbs and supplements is very important, because we know that turmeric and green tea may have hepatotoxicity if it's taken as a supplement. However, if it is given as a food in right amounts, they are not going to be toxic to the liver. So having the discussion, individualizing the care, and making sure that people are aware of the side effects. If somebody is having a brain metastasis from melanoma, it's absolutely not a good idea to be on omega-3 supplement or turmeric supplement or other supplements, which is blood thinning. So this discussion is an integral part of integrative oncology. So again, to recap, we talked about diet, then we talked about exercise, then we talked about mind and body and sleep. The sleep I didn't go more into, but sleep is something that we ask routinely and counsel people on sleep hygiene and yoga therapy or meditation to help with sleep, and acupuncture to help with sleep. And we talk about symptoms, use acupuncture and massage, and then counsel on herbs and supplements. So the resources that MD Anderson offers for patients is both audio and video resources. So right now we have meditation resources, Tai Chi, Qigong, and yoga, and we have to update this, and I think we are going to, or we have to include Isha Kriya and Simha Kriya, since we have studied those and found no adverse effects and that it has worked for patients. So that needs to be done, and that is work in progress, and the website will be updated hopefully in the future. But right now there are several yoga practices that we have. So the way we ask people to do, as I mentioned before, is join the group classes. So people just call our number and sign up for the group classes. And every day we have these classes: circuit class, Tai Chi class, meditation class, yoga. So it's an hour via Zoom right now, and music class. And if somebody wants to have individual attention, either because they don't feel motivated, or they have a medical condition, they have a spinal metastasis, and they cannot just do yoga on their own, then we recommend that they make an appointment with our yoga therapist, who will offer them one-on-one and modify the yoga practices for them. So last but not least, care of the caregiver is also important. Kind of wear your oxygen mask first. And in the pandemic, the healthcare workers has been very stressed. And we do know that Sadhguru offered Simha Kriya practice, which involves pranayama techniques or breathing techniques, which could which might help the lung capacity and other benefits in terms of stress reduction and quality of life. So we did do Simha Kriya studies at MD Anderson for employees or healthcare professionals, and what we found that was so there's two phases to it. So the first study we published was just preliminary findings saying that people are interested in doing it. So it was, we only planned to recruit 50 people, but in one day there were 79 emails that we could not stop at 50. So we increased it to 100, but 217 people wanted to do it. So when we recruited almost 100 people, and 90 in just 1 week, we recruited 90. And most people, almost 70% or 69 participants, which is almost 69% of the people gave some data, and 77% of the people perceived the intervention as useful. So we are still analyzing the data of the study to see what kind of benefit people had, and preliminary results are showing some evidence of benefit, but we have to analyze it a little bit more before we publish the results. So with that, the key takeaway of today's talk is that for our optimal health and well-being, as well as the patient's optimal health and well-being, consider approaching them holistically, both from a physical body standpoint and also their emotional health standpoint. And when it comes to physical health, consider diet. We do not ask the patients to become a full vegetarian, but we ask people to eat more vegetarian-based diet or more plant-based diet and decrease the amount of animal products, which should be applicable to the providers also. And in terms of exercise, suggest exercise routine, incorporate yoga as a part of their exercise routine, both for flexibility and mind-body benefit. In terms of mind-body, both for providers and patients, to consider spending at least 5 to 10 minutes of mental well-being using yoga or meditation or Tai Chi or music, but 5 to 10 minutes of a mindfulness-based practice can take them a long way in helping them to be mindful and decreasing stress. So I always tell patients that it's like this: when you want to lift 50 pounds, you don't lift 50 pounds right away. At least I cannot lift 50 pounds right away. You slowly train yourself to lift it. Meditation and mind-body practices are similar. You slowly train your brain to become more mindful. So if they do mind-body practices 5 minutes each day when they're dealing with a stressful situation, or the rest of the day, they can use those tools to bring their body to what is happening right now. So that can be very effective in stress management. So consider that for your own well-being and the well-being of all your patients. So it can be the 5 to 10 minutes is a precious gift that you can give yourself, or you can help the patient to give themselves. So with that, I would like to conclude our talk. Thank you all for your patient listening. This is our team, and our team with yoga therapists, mind-body therapists, acupuncturists, massage therapists, nutritionists, physical therapists, research assistants, and nursing staff, and 3 physicians and a section chief. Thank you all again.
Thank you, Santhosshi.
Happy to take any questions.
Yeah, thank you, Santhosshi, for that nice talk. And MD Anderson is one of the biggest universities or the centers dealing with cancer patients, and really having you there and introducing some of these practices and assessing them objectively is really a good thing. I wanted to focus on one of the issues that we have. In all pharmacology, every drug, if it is given too much, is toxic, causes some problem. So it's all dose dependent. So we are very careful on the traditional allopathy to describe, toxicity based on the dose. But things like, alternative medicine, for example, turmeric or, any of those situations, you have a case report, suddenly we say, oh, metals, oh, turmeric, this causes cancer. Now, how do we change that language? It's dose dependent, and we have to find, do more studies like that, or just are we going to be dependent on these few case reports that describe these, and totally people immediately say, oh, don't do this because of the liver cancer. We seem to have that tendency.
Sure. So that's an interesting question. Let me make sure I understand your question correctly. So your question is regarding how do we approach when the physicians say that based on these case reports, this is toxic, but there is potential benefits. Is that
Yes.
Your question? Okay. So I understand there is limitations, but of course, a lot of times the practices are based on evidence. So even in my own practice, if a patient is on turmeric supplement, we tend to stop. And it is more relevant when patient is on chemotherapy, because turmeric is an antioxidant, and antioxidants can interfere with chemo and radiation, because chemo radiation works by creating free radicals. So this was only shown in few trials. But however, with a lack of adequate information, physicians always tend to take abundant caution and say that this is not ideal. But using turmeric in the natural way, I know Ayurvedic medicine has used turmeric natural way for multiple years. So probably guiding the patients to use turmeric in a natural way would be safer rather than having them take a turmeric supplement, because when they take a supplement, the dose is very high, and that dose probably the body is not capable of handling, and that is the dose which actually triggers toxicity. So it will be good to help the patient to recircle and use their own diet as medicine. And this is actually shown in mushroom studies, which is my area of interest as well, because there's so much promising evidence in Japan and China showing that mushroom supplements can be helpful. But when we use it in the United States, at one dose, it stimulates the immunity, at another dose, it inhibits the immune system. So rather than saying that those don't work, the natural medicine don't work, I think that it is important that we do studies to figure out how to administer it to patients. So until then, we don't have much confidence to say that it's safe.
100%. So I just wanted you to change the conversation in this way, right? Like dose dependence, how to deliver it, etc. The one more question last, and let it open to the floor. The other question is the healthcare providers, especially the oncology healthcare providers and their health. You seem to have a very large group of people who are taking care of just cancer patients, right? That's just cancer hospital. Has anyone in your particular hospital studied the present level of stress in these providers?
So in terms of stress for healthcare providers, I am not aware of anyone who has done that study, but I'm not 100% sure that I can say that because I need to find out. But as far as I am aware, in the last 6 years, there's not many studies per se. But there is some surveys which is done by MD Anderson, the employee surveys which assess the stress. So every year we take surveys and we have questions on the burnout. So that goes to the management to interpret, and it comes as a feedback to our leadership that the burnout is higher in this department. So those are, it's done in a non-research setting, but not in terms of research setting, asking how much seeing cancer patients or dealing with cancer has an impact on the healthcare provider. So that area is not studied.
Anyone else has any questions? So I'll continue the conversation until someone raises their hand. So another aspect of that is we did that 2 years ago in a perioperative setting, and we found, especially in younger people, have at least moderate levels of stress. So doing something like this is very, very easy because it can be driven by any kind of electronic, like red cap. We use red cap. So similarly, you can use something of that nature there and let people fill in. Almost 350 people filled in our survey, and all we asked was 10 questions. So similarly, you can ask something of the nature and establish that what is the level of stress and anxiety among the oncology care providers. It seems like our initial conversations with them, they all seem to have at least already a basic level of stress. And one other thing that we are trying to introduce here is simply Nadi Shuddhi for them to do it anytime, anywhere. It's just a simple breathing practice for the healthcare providers. Once you have this data and then you give the intervention, that may be more receptive to them, I think. So something to think about.
That's a very interesting idea. I think a lot of people would be interested in something like that.
Because they just need 5 minutes and they can do it anytime.
Yeah, right. Absolutely. And there's a huge interest that we saw in Simhakriya study, that so many people want something. So that shows that people are looking for it. So that's a great idea. Thank you for that idea, Dr. Buzz. That's something that we need to take forward and do it for our healthcare providers, oncology healthcare providers especially.
Yeah, I mean, it's coming from MD Anderson and giving that level. Management also sees it. We're not using it for anything else, but just telling them that these are the professionals who are at a higher risk for stress and anxiety because the nature of the profession. And then we're trying to give them intervention. And maybe you can just do another set later on and divide them into compliant and non-compliant people and see, if there's any change in them. Something to think about. I'm actually, I'm actually happy to see the language around NCCIH changing and evolving. Seems like there's a lot of funding that's available for supplementals as well. So worth looking into those areas for doing research.
Absolutely. Natural product research is given more importance these days. There is some unique challenges for natural product research. One of the main barriers that we find is purity of the product. So a lot of times it's in the basic science level, and then it does not progress further because testing different samples, heavy metal contamination, then it doesn't go to the next level, to the clinical side. So that is one of the biggest challenges in natural product research. So there is a huge gap between the bench and the bedside. So this is one of the reasons.
Great.
But I think that due to the evolving nature of the field, we are still putting a lot of effort in the basic science area. But I think 10 years from now, I see that the field will move forward and there will be more and more clinical studies once this has passed this phase.
I'll leave to
Tulsi raise her hand.
Hello, Dr. Narayanan. Can you see and hear me okay?
Yes, I can see you. I can hear you, Tulsi.
Okay, great. So first of all, thank you so much for this lovely talk and for sharing such a comprehensive overview of a holistic approach to cancer. I am curious about two things. One is, you mentioned about the purity of the different interventions being used. You were talking more specifically of the actual supplements, but I'm curious in terms of the yoga. As a yoga practitioner and teacher, I have noticed a marked significant difference between different kinds of yoga, the way that it is taught, the way that it is transmitted by the teacher, the kind of training the teacher has, does make a difference to the quality of the experience for the participant. So I'm curious, in your studies and in your research, as well as what you offer from the center that you work in, is there a particular type of yoga that you'll focus on? It sounds like you'll have a yoga therapist, but as well offer some Isha-based yoga practices. And I'm curious if you've seen differences between the two and what styles or types of yoga you think would be most suited to cancer patients.
Sure. So there are several components to your question. Thank you for the great question, Fulsi. So one of the components is which yoga is cancer patients. So I would say that it's mostly a judgment call by the patient and the physician. So for most of the patients, like when I think about my patients, almost 40% of breast cancer patients, early stage, and they can do any type of yoga. Whereas if we think about advanced cancer patients, they may not be able to do more advanced forms of yoga, but they may be able to do more meditation-based yoga, such as Isha Kriya. So it depends upon the level of morbidity and the level of deconditioning or their body factors. And the second component of question is what kind of yoga practices do we often provide to the patients? So this seems to be mostly based on what the individual researcher or clinician is more familiar with. So our initial studies were based on our previous faculty, Dr. Chol, who comes from Tibet and was trained in Tibetan meditation, who has done multiple studies. And then Dr. Milbury came in, and she also is in a different department right now. She focused on Vivekananda Yoga, and that's where our yoga therapist is trained in. And I have had a lot of personal experience and benefits from Isha Yoga. And the reason I liked it is because it's very structured and the instructions are very clear and the teachers are so trained, and you don't feel like you're lost. You know that what you're doing, and there is often an explanation of why you're doing what you're doing. So I liked it, and that's why I used it in my studies. Of course, there are several practices, but we have only studied a few practices, and more needs to be studied, the Isha practices, to see how much we can incorporate into cancer patients. That's one of my research interests. But I would say that if a patient asks me what kind of yoga I should do, I would say that the kind of yoga that you like and the kind of yoga that you're going to stick with almost every day or alternate days in your practice. And if they have any questions, let's say if they want to do yoga type AB and they have questions, they can still talk to the yoga therapist and give corrections. So having yoga practice is more important than, and also being taught in the right way is also important, but doing it is the most important of all.
Absolutely.
I hope that answered your question.
Yes, I agree with you that, any beginning is better than no beginning. So thank you for that response. I am curious about the yoga offerings that you all do provide to patients. As a follow-up, if I may ask, is there a certain length of time that you specify is best for cancer patients to practice consistently for, as like a minimum time to see results and to experience benefits?
So I would say that to answer the question scientifically, the studies are so varied. The studies use different kind of practices and different times of practices and different nature of the practices. And some studies, especially sleep studies, yoga and sleep studies, are based on hatha yoga, and it's a very long yoga practice that people need to do. So scientifically, if I have to come up with a time, it's almost impossible because every study is different. So in terms of what is practical for them is to come up with a plan. And it's always, I put it as a part of the whole care plan. So I try to ask my patients to keep at least an hour for their self-care, 30 minutes for their physical health, either doing aerobic exercise, which is walking or yoga, and remaining 30 minutes for resistance exercise. So for some patients, they only have 30 minutes. If they can only do one, I suggest them to do yoga, because if they do certain types of yoga, such as hatha yoga, they can also get strengthening and conditioning, and also can act as resistance, and they have some aerobic impact too. But if they want to do more, if the goal is weight loss, then they need to do a little bit more, like walking and incorporate yoga on top of it. So it's kind of, I would say, customized, but we try to bring them incorporated as a part of the ACSM guidelines of 150 minutes of aerobic per week and 20 to 30 minutes of resistance at least 2 to 3 times a week. So if they do 30 minutes of walking every day, 5 days in a week, and the remaining 30 minutes, if they alternate between resistance and yoga, then they're getting all the 3 components, and that will give the maximum, that is probably going to give them the maximum benefit for patients. So that's what I usually suggest for people.
Thank you. Thank you. All of your responses are very helpful, as I am currently working on designing a cancer rehabilitation program for our patients here at Beth Israel through the Sadhguru Center. So it would be great to have your insights and advice on that once we do have something a little bit more formally ready.
That is amazing. I wish you the best in your endeavors, and I'm happy to help in any way possible.
Thank you so much. And if anyone has any other questions, you can please go ahead and unmute or type it in the chat. We have a couple more minutes before we'll close. Thank you, Dr. Narayanan.
Thank you all, and thanks for having me.